How does insulin lower blood sugar levels? After eating a big, delicious meal, the carbohydrates are broken down into glucose. This is absorbed into the blood. Your body wants it to stay within a certain data range because too much glucose in the blood can damage tissue over time. The pancreas acts like a glucose sensor. When glucose rises, beta cells release insulin into the bloodstream. You can think of insulin as a signal molecule telling the body to start absorbing and storing it because there is plenty of fuel available at the moment. Insulin travels through the blood and attaches to the insulin receptors on the cells, especially muscle cells, fat cells, and liver cells. This activates a signaling pathway inside the cells. Then the muscle and fat cells pull glucose out of the blood. One of insulin's most important actions is moving glucose transporters like GLUT4 to the cell surface. Without insulin, many GLUT4 transporters stay hidden inside the cell. With insulin, GLUT4 transporters move to the membrane. Glucose can enter the cell rapidly. Blood glucose levels begin falling. In other words, glucose is like people standing outside of a building. GLUT4 are like the doors, and insulin tells the building to open more doors to let the people in. Once inside, cells can use or store the glucose. In the muscles, it can burn for energy or be stored as glycogen for later use. In fat tissue, glucose makes and stores fat. In the liver, insulin tells the liver to store glucose as glycogen and tells it to stop making glucose. Liver is extremely important because it can release glucose into the blood even when they are not eating. Therefore, when insulin is present, insulin suppresses glucose output. Overall, insulin lowers blood sugar levels by causing cells to remove glucose from the blood and pushing the liver to stop adding extra glucose. This allows the concentration of glucose in the bloodstream to decrease back to normal levels. According to the ADA guidelines, the A1C goal for a non-pregnant person is less than 7%. Preprandial is 80 to 130, and postprandial is less than 180. Don't forget to like and subscribe for more content.